Minister of VSA says the need to expand testing capacity is why antigen testing is being considered. Darren Wilson is station's new airport manager, and MP for NA says that the presentation made by Minister of TAYAT does nothing for them. Those are the headlines for Tuesday, October the 27th, 2020. Good evening, viewers. This is SXM Daily News, and I'm Valerie Van Putten. And as usual, we have a full newscast for you this evening, so let's get started. In our first story, with 72 stores closed on Front Street and 360 workers out of work, the taxi industry, with 250 taxi businesses which has been grounded to a halt, and a total of 785 workers out of work in 2 industries, Member of Parliament for the National Alliance, Christophe Emmanuel, says that the presentation made by the Minister of TAYAT does nothing for them. MP Emmanuel made a statement at the parliamentary meeting on Friday, October the 23rd, 2020.
Mr. Chairman, right now, 72 stores on Front Street are closed. That is 72 times 5 employees. Mr. Chairman, that's 360 workers. 360 workers right now, Mr. Chairman. Mr. Chairman, the taxi industry, the business, and I'm going on the low side of 250 taxis, business has grinded to a halt. Nothing, no movement, because that's all they do. It's when you drive on the Pondfield Road, you see taxi buses for sale. You see them for sale. When you go and sell, buy, and borrow, you see them for sale, because that industry, that business has grinded to a halt. Let's say grade Bay workers of 175 individuals, Mr. Chairman. So we are talking about 360 workers from Front Street, 250 taxi drivers, 175 grade Bay workers. In total, we are talking about 785 individuals just by 2 industries out of work. And here we have a presentation today that says and does nothing for them. That's the problem I have with the presentation. The immediate solution I didn't get from the presentation. The long-term solution, I understand and I can see it and I can agree. That's the long-term solution. I see that. But the solution as of now, how are we going to deal with this situation? I didn't see it in the presentation, Mr. Chairman. In addition to that, Mr. Chairman, I just want to ask the minister 2 questions. Mr. Chairman, the minister made mention that the intention is to lower the wage tax. I would like to know, will this be lowered structurally? What does that mean for the employee who is paying 47.5%? The employee who is paying 40% or 32.5%? Will it be decreased by 5% or 15%? In addition to that, Mr. Chairman, the minister made mention of several reasons why the profit and the income tax should be reduced in an effort to stimulate the economy. However, can the minister specifically both taxes will be reduced? Can the minister specifically indicate to what percentage both taxes will be reduced? And there's a reason why I'm asking that, based on those same numbers that I just made mention of, Mr. Chairman. Based on those same numbers that I made mention of. And if you have to times those numbers by 2, we are over 1,500 individuals from 2 industries that's out of work, and that presentation did not, Mr. Chairman, it did not indicate how we are going to remedy and solve this problem. Now, Mr. Chairman, if my good colleague MP Utley can say I told you so, then what it is I should say. Because I can remember telling this to my good colleague about rapid testing way back then. I can remember screaming to the government about it way back then. However, we are where we are today. Now I'm asking this question not only to the ministers, but to the whole entire Council of Ministers. I want to know if they listened to the Honorable Right Prime Minister of Barbados a few days ago, the Prime Minister Mia Otley, when she said that we as Caribbean nations should pivot ourselves in this region.
Meanwhile, Member of Parliament for the UP party, Siddharth Bijlani, applauded the Minister of TA's great presentation. The MP said that the minister thought outside of the box and had a hands-on-deck approach, and is doing everything possible to turn the economy around.
First of all, I will really take this opportunity to applaud the Minister of TIAT for a very great presentation, thinking out of the box, hands-on-deck approach, and giving out everything possible that we can turn around the economy. Also, I would like to thank her for including many individual businesses when she was making this plan. That was a real great approach, because I got many people who called me up and said that they were being asked about the economy. But I do believe with some of the MPs, what they're mentioning, that we do not have a short-term approach. We need to tweak a little bit, and we need to see that the economy gets in motion ASAP. So please look into that and see how we can get back our tourists. So the approach what MP Otley mentioned about his plan with the motion, I would say that would be a great idea to look into. So instead of having just few tourists, we can have enormous tourists. And that's the only way, because whatever kind of stimulus we are giving, it's only helping one side of the economy. The business owners are not getting completely out of that money which is getting to them. It's only for the employees. But there are other 30 to 40% expenses which they incur, and that if there is no business, they cannot take care of that. So not having business that's the reason MP, I think he got a better count. MP Emmanuel said 78 businesses have closed. To me, it is about 130 businesses in Phillipsburg. So I don't want that number to escalate any further. So Minister, please look into tweaking the short-term plans. And most of this is only my tips, very few questions. Can you explain the turnaround of the 11 billion guilders in our economy, and how did you derive to that number? It's just as a layman, I want the people to know. What I don't see is the direct relief for the businesses, and I want the business to be, economy to be picked up. So please, I would say, let's see how we can gear up the influx of tourists back into our island. Also on the cruise lines, do you have any updates on the policies they are going to come up, and how will it benefit to each business on the island? Island-wide, not Phillipsburg, not Front Street, island-wide, how will it benefit? I want you to make sure that the policies, what they come up with, are not like the bubble entries. Like they just bring in tourists, they go to selected places and go back. That would not really help our economy.
And now in news out of the island of St. Eustatius, the island of St. Eustatius recently acquired a new manager for the F.D. Roosevelt Airport with the appointment of Darren Wilson. Darren Wilson took over operations at the airport from interim airport manager Richard Van Dinter on Monday, October the 19th. Van Dinter has been overseeing airport operations since the departure of interim airport manager Rick Isarin in July. Mr. Wilson was born on the island of St. Martin, but his ancestors hail from the island of Saba. He started his career in aviation back in 2005 at the Air Traffic Services Department at the Princess Juliana International Airport in St. Martin as a flight information officer, and then moved up to air traffic control assistant before leaving for college. He attended the Florida Institute of Technology, where he earned a bachelor's degree in aviation management, and on completion of his degree, he returned to St. Martin, where he worked as a quality assurance officer and airport operations officer at PJIA. Stacia's reconstructed airport is expected to be completed in the first quarter of 2021. The airport originally was expected to be completed at the end of 2020, but due to the COVID-19 pandemic hindering the arrival of essential workers, the completion date for the project had to be pushed back. And still to come, St. Martin Medical Center temporarily adjusts operational hours at the eye care clinic. We'll have the details to that story and more when SXM Daily News returns.
GEBE has been faithfully serving the communities of St. Martin, powering your home and our economy. Come rain or shine, our qualified team of professionals are working hard 24 hours a day to provide you and your family with safe, reliable electricity and water. We use the latest technologies and test our products daily to maintain the highest international standards. Our friendly staff is always there to assist you, whether in person, over the phone, or online. We are committed to constantly improving our products and services, making them more efficient, effective, and environmentally friendly to serve you better today and our next generation of clients tomorrow. GEBE, powering a brighter future.
Our friend Megawati is here with tips to save you energy. 1. Turn your airco temperature up. 2. Use a ceiling fan instead. 3. Buy energy-saving products. Save some green with NVGEBE.
Welcome back, viewers. You're watching SXM Daily News, and I'm Valerie Van Putten. In news out of the island of Bonaire, Foundation No Scare Bonaire Back and the people of Bonaire has congratulated the people of Stacia with the overwhelming victory on October the 21st, 2020, reaffirming the PLP leadership as their legitimate legal democratic representation. The Stacia people showed with this win that they never accepted the betrayal and violation of their sacred democratic rights and sent a clear message to The Hague. In February 2018, the Dutch government, led by the military-poised State Secretary Colonel Knops, deposed the same government with the same leaders through an undemocratic act, abuse of power, and coup d'etat. A historical moment of victory to the Stacia people, strong and determined, defeating Dutch 21st century colonialism. A resounding rejection against Dutch colonial rule, very loud, very clear, claiming back and restoring the government they have elected themselves in March of 2015. Reassuring that the people are the ones that has to judge and decide which government they want. This serves as a message of courage and hope to all other Antillean islands, especially the autonomous bigger islands of Curaçao, Aruba, and St. Martin, that are at the moment under duress of the Dutch government, using the COVID crisis to blackmail them, forcing them to cede their autonomy for a loan with improper conditions. Stacia has risen again and standing tall as a nation of people with dignity that want to decide for themselves on their own island, to determine themselves their own destiny, and want to protect their inalienable fundamental right to democracy, right to self-determination, and self-governance. Today, we are looking back on these recent historical battles for the rights of the Stacian people, but more importantly, now is the Stacia people heroic action that decided to put the same courageous government leaders back at the front of the struggle to continue fighting for them, moving forward, seeking their rightful self-determination and human rights. The release reads in part and was signed by James Finney's President, Foundation No Scare Bonaire Back. And in other news at this time, Minister of VSR, the Honorable Richard Panafleck, was in the hot seat recently when he had to answer questions posed to him about the COVID-19 testing. The minister said that the need to expand testing capacity is why antigen testing is being considered. He also wanted to clear up the different antigen tests that are being used, and he clarified a number of other health issues.
The question asked if the testing accuracy between the two testing methods, as stated by me, is 2%. I said that's correct. The PCR test sensitivity is greater than 97%, while the specificity is greater than 99%. The Abbott rapid test sensitivity is between 64 to 81%, while the specificity is 99%. Therefore, the Abbott rapid antigen test is inferior to the PCR. Considering this, the CPS testing strategy is justified. While CPS acknowledged that the anti-test is inferior, CPS recognized the need to expand testing capacity, which is why antigen testing is already being considered. I have to say, to make this clear to everybody, there are different rapid antigen tests. It's like different, not models, but brands of anything, like cars or anything. You have those that are from higher, and you have those that are from lower. Like, for instance, the Becton Dickinson, the same figures are 94.1% and the 99% of the specificity. So in this case, between two rapid antigen tests, you will see that the Becton Dickinson is of higher grade than the Abbott, just to give some clarification. The next question, if the island opens up with more tourists coming, can you tell what our threshold or how many patients can we handle COVID related? To date, the number of imported cases has been less than 1%. As we receive more tourists, we would expect an increase in numbers. In terms of the number of patients we can handle, Samata Medical Center has the Hospitainer with a capacity of 20 beds. We would take into account multiple variables to determine the status of COVID-19 transmission on the island. These would include some of the following: incident rate, hospital admission, and deaths. Question number 3. I know the tent for COVID patients is not there anymore, and they have containers set up. Can you elaborate on that structure and how many patients can they handle? The Hospitainer is exclusive for COVID-19 patients. The current capacity is 16 beds, as allows 6 ICU beds, 6 intermediate care, and 4 rule-out rooms. Instead of the tent, for clarification's sake, they have the container structure that is more better resistant to the elements of nature, nature of weather. The drug, question number 4, the drug revisor, which I believe is widely used now in chronic cold cases. Where is the matter on that? Are we using that drug on COVID, the patient, or what other ways and technique are we using to save chronic COVID patient? Currently on St. Martin, the steroid dexamethasone is used to treat patients at the Hospitainer in accordance with the international guidelines. The World Health Organization has recently shown no effect of remdesivir on reducing mortality, even though the FDA has since approved it. Minister, question number 5. Minister, are you aware that presently the rule in St. Martin is that if a crew member doesn't have a negative PCR, they have to self-isolate until the next flight? Seeing the French side doesn't have this rule, all overnighting crews have moved to the French side, and we are losing out on this business. Why is that happening? This is misguided. If crew are here for 24 hours, they do quarantine at locations on Dutch side of the island if they do not have a PCR test. In the meeting today with Prime Minister and the French side President, Mr. Gibbs, I understand that our Prime Minister supports the rapid antigen test. Is the Council of Ministers on the same thing as the Minister of VSA, who is depending solely on VSA Ministry of decision-making regarding survival of the economy of this country? The Prime Minister supports aligned testing strategies and protocol. Discussions are ongoing with ARS in pursuit of this outcome.
And in more news at this time, St. Martin Medical Center has announced the temporary adjustment in operating hours of the eye clinic, the ophthalmology center, due to COVID-19 travel restrictions for its team of rotating eye care specialists. As from Monday, October 26, 2020, the eye care clinic will open from 8 a.m. until 2 p.m., Mondays through Fridays. In addition to St. Martin Medical Center's permanent eye care specialists, Dr. Benny Osterhoff, St. Martin Medical Center Eye Care Department is strengthened by a rotational team of eye care specialists from the Suriname Eye Center. After the reopening of the Princess Juliana International Airport, the rotating specialists traveled to St. Martin via the Netherlands, as there were no direct flights between Suriname and St. Martin due to the Netherlands issuing a code orange travel advisory for St. Martin. Traveling via the Netherlands was no longer a viable option, and as such, as per October 26th, the clinic will reduce its hours until further notice. The medical center apologizes for any inconvenience the adjustments in these hours may cause and urges all patients with existing appointments that are scheduled to occur after 2 p.m. and have not been contacted by the St. Martin Medical Center to reschedule their appointments by calling 721-543-1111, extension 1375, from Monday through Friday, 8 a.m. to 4 p.m. to do so. St. Martin Medical Center's eye care clinic, located behind St. Martin Medical Center at the Care Complex, caters to both children and adults and performs a wide range of eye care procedures ranging from glaucoma and cataract treatments and surgeries to eye exams. Patients wishing to make new appointments can do so by calling the aforementioned numbers. Now, turning to our weather forecast for October 27th, 2020, a tropical wave located over the eastern Caribbean will account for cloudy periods, isolated showers, and possible thunderstorms across the region. Persons in flood-prone areas should be vigilant. Small craft operators and sea bathers should continue to exercise caution, as seas are expected to peak at 9 feet. The outlook through Thursday midday: partly cloudy to cloudy and breezy with isolated showers. Now let's turn to your 3-day forecast. And still to come, Minister of Romy defends his vision for Phillipsburg. I'll have the details to that story when SXM Daily News returns.
The innovative Banco Matico contactless smart card. Your Banco Matico smart card is now equipped with a contactless feature for payments, so get ready to tap and go. Contactless payments are fast, easy, secure, and accepted worldwide at all Maestro-enabled contactless terminals. Tap for transactions equivalent to or less than 100 NAF, or the US dollar equivalent. You will receive notifications via email anytime you tap. Tap, tap, and pay fast with WIB. For more information, visit our website at wib-bank.net. Tap and go with your partner in progress.
Welcome back, viewers. You're watching SXM Daily News. And in this COVID-related item, as of October 26th, there were 5 persons who tested positive for COVID-19. However, there was a recovery rate of 5 persons, causing the active cases to remain at 57. The total number of confirmed cases is now 789. The Collective Prevention Services, CPS, are monitoring 50 people in home isolation. 6 patients are hospitalized at the St. Martin Medical Center, and 1 patient is isolated and being monitored. The total number of deaths due to COVID-19 remains at 22. The number of people recovered since the first case surfaced on St. Martin has increased to 710. 110 people are in quarantine based on contact tracing investigations carried out by CPS of persons who may have been in contact with any of these active cases. CPS has tested 1,171 travelers arriving at the Princess Juliana International Airport and 5,558 people throughout the community. As the numbers continue to fluctuate, CPS will continue to actively execute its contact tracing measures. Minister of Public Health, the Honorable Richard Panafleck, is informing the general public that they have received negative COVID-19 test results from Healthcare Laboratories St. Martin, HCLS, hence the spike in the numbers tested outside of the airport. He would also like to correct that the total number of patients hospitalized at the St. Martin Medical Center on October the 25th should have been 5 and not 6 patients. And as we end this edition of SXM Daily News for this evening, Minister of Romy, the Honorable Egbert J. Doran, speaking on the Super Duper Morning Show on Laser 101 Radio recently, defended his vision for the project for the capital of Phillipsburg. The Honorable Minister says that our capital is in a deplorable state and that Phillipsburg is ours. And if we want to enhance our product, we have to enhance the way things look as well.
Last week I presented a vision, the vision that I have, me as a Vromy team, because it's not a sole effort of the minister. We have to remember that, you have civil servants, you have advisors as well. So that was the vision that we came together with as a team, because at the end of the day, when we look at our capital, it is in a deplorable state. And that is our capital, this Phillipsburg, that's ours, And we are a tourist-based destination. And if we want to focus and enhance our product, we have to enhance the way things look as well.
Right.
One of my main concerns has always been, the way the pond fill look, since the hurricane, which is over 3 years now, the former government building is in a deplorable state. And one of the main things, and even in the article is very clear, it indicates that this is the vision that I have, because when you look at it, we spend about, besides the current government building that we're in, we spend about 10 million a year in rent. You can't, if I can't be on one end encouraging home ownership and stop paying rent, because at the end of the day, you keep paying rent, then it belongs to someone else.
Right.
So we have to promote it on our level, and it starts from inside as well. So that is basically the gist of it all. We have we have in the Vineyard building, all the different government offices that are outside, and it's a lot of money we spend per year.
Including Parliament.
Including the Parliament building.
Right for that as well.
So a lot of people misconstrue or misunderstand, so that's why I want to make clear as well. The new government building isn't to move those that are in the government building outside.
Right.
Because even the current government building is jam-packed. There's no space. So the fact is to do all those separate outside offices, to bring them in one central location, and we go from there. There are several commercial units that I drew reference to as well in the release. I got several calls from franchises, restaurants, and different things, government-like entities, and if you want to call it those, inquiring about a potential spot. So there's a lot of positive response as well.
Okay. But one of the main concerns, like a lot of people pointed out, is the financing of this project, especially since the country basically has no money. So, everyone wants to know where would this money come from for this project.
Well, the nitty-gritty of the financing, I don't want to divulge that here now, but that's why I put in the article as well, public-private partnership. As Minister of Vromy, my responsibility and my competency is over the land. Land is value. So if you go to the bank with X amount of square meters, that is your collateral. That is what you can use to borrow to finance whatever you want to build, which would most likely be a home.
And with that, viewers, it brings us to the end of this edition of SXM Daily News for this evening. I am Valerie Van Putten. Thanking you so much for joining me. And just a reminder that this and other programs are available online. Simply log on to stmartinmediacenter.com for viewing. And on behalf of the SXM Daily News team, we thank you so much for watching and plan on meeting you right back here again tomorrow.